All right, well, we will go ahead and get started here. Hello and welcome to Great Plains Quinn Focus for Health. My name is Jennifer Everson. I'm a RN Quality Improvement Advisor for the Great Plains Quinn. This Focus for Health is hosted by the Great Plains Quality Innovation Network, the Centers for Medicare and Medicaid Services, Quality Innovation Network, Quality Improvement Organization for North Dakota and South Dakota. To make this interactive, if you have a web camera, go ahead and turn that on. Today's webinar is being recorded and will be posted within 1 to 2 business days on our website at greatplainsquinn.org under the Focus for Health link. We will also share that link with you in the chat. If you have questions as we go, please add them to the chat as well. And then there will be a resource handout that includes all resources shared during today's session and previous sessions in this series. You can access the document through the link that Carrie will place in the chat. All right, next slide. This month's Focus for Health is Culture of Safety. Here on the slide are our objectives. If you've been following along, you know the first 2 weeks of the series, we have covered culture of safety in healthcare and high reliability organizations. Today, we will cover AHRQ's team steps and the SAP surveys. We will round out the series next week with just culture. Next slide. As a frontline provider, you directly see the impact of poor communication and ineffective team leadership on patient safety, organizational efficiency, and staff morale, burnout, and turnover. I don't have to tell you that effective teamwork and communication are foundational to providing every patient with high quality, safe care throughout the healthcare system. It is said that according to a retroactive review of medical malpractice claims published in the Journal of Patient Safety in 2022, nearly half of the claims included a communication failure. Furthermore, 53% of communication failures involve miscommunication between patients and providers. Team strategies and tools to enhance performance and patient safety, or more commonly known as team steps, was created by the Agency for Healthcare Research and Quality, otherwise known as AHRQ, as an evidence-based framework to optimize team performance across the healthcare delivery system. AHRQ recently updated Team Steps 3.0 to emphasize patient engagement at the center of care. Major emphasis of Team Steps 3.0 is patient focus, integrated Team Steps platform. It consolidates content from prior versions of the curriculum into a single integrated resource, includes modular course design. It can be taught in sessions of varying lengths, active learning strategy, and emerging team challenges and opportunities. Next slide. As mentioned on the previous slide, Team Steps is an evidence-based framework to optimize team performance across the healthcare delivery system. It requires clearly defined and appropriate team structure and the use of 4 teachable, learnable skills: communication, team leadership, situation monitoring, and mutual support. The Team Steps framework reflects the connections between these 4 skills and how they contribute to knowledge, attitudes, and sustained high performance needed to achieve highly reliable, safe, and effective care for every patient. The Team Steps Pocket Guide provides a quick reference to key concepts and tools. These tools, as well as the methods for providing training on these tools, are described in greater detail in each of the sections, sections of the modules. Next slide. Like I previously mentioned, Team Steps consists of an introduction and 4 modules: communication, team leadership, situation monitoring, and mutual support. It is recommended to select the curriculum to your specific role. The roles include patients and family caregivers, frontline providers, administrators, experienced trainers, new Team Steps trainers, and trainers of pre-professional students. Next slide. The first module is communication. Communication involves two or more people continuously sharing information with each other and involves listening and communicating using verbal and nonverbal messaging. Listed here on the slide are the evidence-based tools part of TeamSTEPPS 3.0 communication module. Situation, background, assessment, and recommendation or request, or known as SBAR, is a technique for communicating critical information that requires immediate attention and action concerning a patient's condition. Closed-loop communication ensures that messages are correctly understood using methods such as call-out, checkbacks, and teachbacks. Handoff is a standardized method for transferring information during transitions in patient care, and iPass is a preferred handoff tool for patient transitions in care. The communication module in TeamSTEPPS 3.0 goes into greater detail of utilizing these communication tools in the curriculum. Today, we're just providing a very high-level overview of each of the modules in the program. Next slide. The second module is team leadership. Teams are sets of people communicating, coordinating, and collaborating to provide optimal care. Safe and efficient care involves the coordinated activities of a multi-team system. Effective team leadership includes responsibilities such as to organize a team, identify and articulate clear goals, assign tasks and responsibilities, and facilitate information sharing. Effective team event tools include sharing the plan, the brief, monitoring and modifying the plan, the huddle, and reviewing the team's performance, the debrief. Checklists are an effective way to stay organized within a team. Again, the TeamSTEPPS 3.0 team leadership module further elaborates on all these team leadership tools. Next slide. The third module is situation monitoring. Situation monitoring is a three-part process in which the individual skill of situation monitoring fosters situational awareness. Collective situational awareness fosters a shared mental model needed for effective teamwork. Situation monitoring is an individual skill. Situational awareness is an individual outcome, and a shared mental model is a team outcome. Tools included in this module are STEP, which is a tool to help individuals monitor critical elements of a situation in the overall environment. I'm Safe Checklist is a simple checklist that can be used to determine the ability of you and your team members to perform safely. And cross monitoring is a harm error reduction strategy. And STAR is a tool that is used to elicit and share key information about activities and their consequences. You may have heard or used some of these tools in your facility. Next slide. The fourth module is mutual support. Mutual support, also called backup behavior, involves team members assisting one another, providing and receiving feedback on performance, and advocating assertively when patient safety is threatened. Some of the tools included in mutual support are task assistance, which is just simply helping others with tasks. It builds strong, trusting teams. Formative feedback is information provided to team members through verbal or nonverbal communication, either intentionally or unintentionally. This is used to improve team performance. Advocacy and assertion is a strategy to advocate for the patient and assert a corrective action in a firm and respectful manner. And the 2-challenge rule empowers all team members to stop the line if they sense or discover an essential safety breach. Stop the line can be done with CUS. I am concerned, I am uncomfortable, and this is a safety issue, using assertive statements. The DESC, or the DESC, is a constructive approach for managing and resolving conflict. Next slide. Of the ton of information, and we only skim the surface of the strategies and tools to enhance team performance and patient safety in TeamSTEPPS 3.0. For more information, please access the AHRQ website for full description and available resources and tools to get started. We are planning a deeper dive with an additional Focus for Health series next month in November on TeamSTEPPS 3.0 to expand further into the training. The next slide. We also wanted to briefly touch on the AHRQ surveys on patient safety culture, otherwise known as the SOB surveys. These surveys ask healthcare providers and other staff in hospitals, medical offices, nursing homes, community pharmacies, and ambulatory surgery centers about their organizational culture's support for patient safety. The surveys can be used to raise awareness of and improve patient safety culture in your organization. We recently had a LAN event with speakers from AHRQ giving a more in-depth presentation on the SOB surveys. If you're interested in that LAN event recording, please let us know and we will place a link in the chat for that recording. The next slide. Here's a quick little video from AHRQ I thought was a very nice and comprehensive way to understand the surveys.
When it's time to assess patient safety culture, why should your organization choose the AHRQ Surveys on Patient Safety Culture, or SOPs? Here are 5 reasons. 1. The surveys were developed with extensive input from healthcare professionals and experts to make sure they ask about the most important aspects of patient safety culture. 2. The surveys were comprehensively tested, so they will reliably assess clinician and staff perceptions in your organization. 3. The SOPs databases include survey data from hundreds of healthcare organizations so you can compare your results. 4. You can use your survey results to identify strengths and opportunities for improvement. And 5. AHRQ offers free technical assistance and resources to help answer your questions. Using the SOP surveys will help you raise awareness and improve patient safety culture in your organization. Learn more at ahrq.gov/SOPS.
Next slide.
When it's time to assess patient safety culture, why should
okay.
your organization...
It is a cute video, but we'll probably just watch it once.
I'm having trouble advancing the slides, so let me try again here. There it goes.
No problem. And I just want to kind of reiterate the 5 reasons. Just, learners to hearing and seeing is sometimes effective. So I just wanted to reiterate the 5 reasons to use the AHRQ SOB surveys is just that they're developed with extensive input from experts and staff. They're comprehensively tested, reliable, and they're a valid instrument. They're widely used and they compare results to hundreds of organizations. They're actionable, and then they also offer free technical assistance, and there's resources available. Next slide. And then higher SOPs nursing home scores have been linked to lower turnover rates, lower use of physical restraints, fewer falls, and a higher CMS 5-star quality ratings. The next slide. And then, so for more information on AHRQ SOP surveys, the AHRQ website provides additional information, resources, and tools to get started. Next slide. We will now move on to the office hours portion of this call, and we'll open up to any questions or discussions you may have on the AHRQ team steps or the SOP surveys. And I had a few questions just kind of ready to help any discussion if nobody has any specific questions. And just curious, has anyone ever completed the team steps training, either formally or informally? You can put it into the chat, or you could come off mute if you had a comment you wanted to place. As I was preparing for this presentation, a lot of the tools and resources, I didn't really make the connection that they were all part of team steps because there's so many of them that are available and that are pretty common these days in healthcare organizations. Just to pull out one, the SBAR tool. That's one I've used in a nursing home. I've used it in the hospital. And then we were even kind of having discussion as a group that even here at Great Plains Quinn, we use the SBAR tool to make requests to our leadership on specific things that we need a timely response on. So they really are tools that can be applied to, a lot of situations and a lot of settings as well. The other part is just the HRQ SOB surveys. If anyone's ever used those or have questions or interest in those. I don't know if anyone
I
had
did put
any.
in the chat last month, I think it was mid-September, we had the HRQ staff do a learning event on the value and the application of those SOP surveys. And so I put the link to that event on our website where you can access the 1-hour recording, but they did a really good job of making that, I think, meaningful and also, easy to understand for those that are new to this
Yeah,
endeavor.
absolutely.
I use the SOPS surveys in a former position. We use them in the hospital and then also in the nursing home. We had used them, and I just really felt like as an employee, as a staff nurse, that really gave me an opportunity to have input into the areas that I felt that our organization was doing really well in for patient safety. But then also I was able to mark lower scores or, for those areas that I thought that we needed improvement. I think it gave everybody an opportunity in the organization to have a voice because everyone was invited to complete the surveys, from housekeeping, dietary, the CNAs, the leadership was able to complete them too. And I think if you're in a leadership position, sometimes you think everything's just, going along pretty hunky-dory. And, I think those surveys really allow the staff an opportunity to anonymously provide feedback on areas that they feel, there could be some improvement on. And so I appreciated the opportunity to, complete those surveys. But then on the other hand, the leadership also needs to take that information and do something with it. You can't just, ask for all this information and then just let it sit. So, on those areas that need improvement, you can do root cause analysis to find out, more information about, what areas might need to be improved in those patient safety categories, which covered communication and a lot of different areas. So I found that as a helpful tool. I'm very pro using those surveys on patient safety in any healthcare organization.
Yeah, definitely. It made me think of too, within communication, the teach back method, is part of a way to, help patients and residents kind of reiterate what they understood, and it's your opportunity to provide, clarification or, re-education if they didn't get the message as planned. That our newsletter yesterday was it yesterday, Carrie, that came out with the information about teach back?
Yeah.
And we do have a lot of different tools. We have videos, we have forms to use. So GP Quinn does have a ton of information on teach back too, which to me is such an age-old tool, but also a problem that continues to happen is the message you intended was not received, and that miscommunication between providers and patients, like I kind of stated at the beginning, is more than half of the communication failures are related to just a misunderstanding between the two.
I am just putting that link to that blog post in the chat.
Yeah,
Awesome.
and I think on the webinar yesterday, there was kind of an interesting comment made about a patient who didn't understand their instructions, and instead of taking their blood sugar daily. They were reporting their weight rather than their blood sugar daily, and their insulin was being adjusted based upon the information that the provider thought was the
Oh my gosh.
glucose, the blood sugar. However, the patient was reporting their weight. And so you can imagine that there was probably an ER visit related to that. That did occur because that
depending on what their weight was, but yeah.
Yeah.
They're 250.
Well,
That's concerning versus like
this
110
this
pounds.
person ended up in the ED. So,
Oh.
But anyway, so I mean, I thought, wow, there was a big disconnect with that information. So yeah, teach back is pretty darn important to make sure that the instructions are understood when leaving the hospital.
We take it for granted. A lot of those portals where you can go back and see your visit summary and what the doctor wrote with your note, when you can do that for your family, is so crucial, because you get to see the real information, and maybe not their perception of the information they were told.
Mm-hmm. Yeah.
That has made it a little bit easier to have that access to those online records.
Mm-hmm.
We can go to my next slide. Just the resources that I referred to within the presentation are here, and then they will also be included in our resource document that Carrie has in the chat already. So if you want some more information on any of those links will be in there for you. And then our last slide, depending if there's no questions or discussion, we just want to thank you so much for attending today. Please complete the webinar evaluation so we can continue to work to make our time together valuable. We really appreciate your feedback. Attendees will be dropped off at the evaluation at the conclusion of this call. If it's easier for you to, you can scan the QR code or click the link within the chat to complete the form. As always, we really appreciate your feedback on these weekly Focus for Health sessions, and also any ideas you have on future topics that you'd like us to cover. And we just want to thank you for joining us, and enjoy the rest of your week.
Thank you, Jen.
Bye-bye.